So the origins for this project came from about 18 months ago. Planned Parenthood Toronto organized a research planning meeting that focused on youth, sexual health, and technology. And this area emerged as a priority kind of research area because we know that sexual orientation is a key factor and in the extent to which youth seek sexual health information online. A recent study shows that 78% of sexual minority youth access sexual health information online compared to only 19% of heterosexual youth.
This project impacted the community by being embedded in community-based research principles. The content came directly out of focus groups conducted with the people that Planned Parenthood wants to serve, thus placing their needs first.
I thought this project was important because it addressed a gap in the information needs of queer women, and it's a gap that I felt myself. It came from an understanding that reaching out to a community of young queer women across the city and basically across outside of downtown as well, and trying to address the fact that we're a very different community.
I felt like as a teenager there was no sort of information available about health and safe sex for queer women, and it was one of those things where, because it wasn't mentioned in the curriculum or in any sort of pop culture conversation, it felt like it was inherently wrong to sort of explore that identity and that sexuality. So I felt like this was an opportunity to sort of gather that information and hopefully make a difference in both the curriculum and just sort of communities and how we're talking about it, because I kind of feel like queer women haven't really had as much of a space, and so I was hoping that this project would sort of help with that.
I think even further research would be incredible, an opportunity for youth to have a think lab or an innovation space where they can continue talking about these kind of ideas. Basically any opportunity for youth to continue to have a voice in the process of where sexual education, especially in this digital age, is going.